Hello, good afternoon. Thank you for being here. My name is Barbara Orticelli, and my teaching demonstration is on motivational interviewing within the scope of counseling. There are 3 outcomes to motivational interviewing. Defining motivational interviewing as a counseling style. Identify the 4 components of motivational interviewing, which are your OARs. We'll discuss that more in a next slide, the next couple slides. And then the last learning outcome is explain the spirit of motivational interviewing, which is really important and the glue that puts this style of counseling together. What is motivational interviewing? Motivational interviewing is client-centered, which means that the client comes first. It's a partnership between the counselor and the client. The counselor is not always going to have the answers. It's going to be client-driven, which means that the client themselves will participate in the session and to make the decisions for their future. The second is the directive method. This method is for enhancing the motivation to change and for the client to make a commitment to change. If you have an alcoholic who drinks and they know that they drink, they have to say, okay, I need help. So it's a commitment for them to have a trajectory to change. And then by resolving the conflicts that they have in their life because of their addiction or because of their concern, resolving the issue that they bring into the counseling session. And finally, exploring ambivalence. Ambivalence means that I know I'm an alcoholic, I know I need to change, I know it's destroying my life, I know it's causing disturbances within my life. However, I'm still not ready to make that commitment to change. There are some goals to motivational interviewing that's really important that the counselor really needs to reflect on and use in the actual session. The goals is, the first one is to motivate healthy behavior change. If you are overweight, we want you to be able to not only exercise, but have the right dietary measures to lose the weight. So it has to have a balance. You can't expect the client to go out and just not eat. So there has to be a healthy behavioral change for the client. To understand and to resolve ambivalence about current behaviors. The behaviors that they are having that are getting in the way of their commitment to change. Third, to create and amplify discrepancies between present behaviors and broader goals. What are some goals for the client to have concerning their weight? Okay, well, for the first week, my goal is to lose 2 pounds instead of trying to make a goal of 10 pounds. My goal for the next 90 days is maybe to lose 15 pounds. So the counselor's responsibility is to ensure that the client's goals are attainable and reachable, and they don't try to do it all in one setting. And then the next slide is concerning the spirit of motivational interviewing. And I wanted to read from Miller and Rolnick, Motivational Interview, Helping People Change. This is a really important book. This is where I received or attained most of my information. The spirit of motivational interviewing is more than the use of set of technical interventions. A lot of counselors, they want to be so technical with the client, but there's no humanity in that. There's no connection with the client. It is characterized by a particular way of being, which means the MI is done for and with a person and not against the person. This way of being is described as the spirit of motivational interviewing. The spirit of motivational interviewing is the foundation of every MI conversation that takes place, not just in a counseling session, but maybe in a doctor's office, or if you're in a classroom setting and the professor needs to talk to you about your grades, or maybe you having a life crisis, so you pull your professor aside and he wants to talk to you. That's motivational interview, and then there's a spirit behind it, God's spirit behind it. It communicates compassion, acceptance, partnership, and respect. A counselor, just because you're the counselor doesn't mean you don't respect the client. That's farther from the truth. You definitely have to have respect for your client, and it's a partnership. It's not the counselor's responsibility to come up with solutions all on their own for the client. Does that make sense? So that means when I go in there and you come into my session, you should be, after we talk about that, you should be able to come up with some attainable goals, things of that nature for you to want to change. And acceptance, as a counselor, I shouldn't use my biases against you. I should be able to be acceptance of what you're going through, what your concern is, if it's your addiction, or if it's just a concern that you have that brought you into my counseling office, whatever it may be, I have to be able to accept you. That being said, I have an actual video to be able to show you a actual counseling session with motivational interviewing in it, or an actual conversation. So let me just click on this real quick. Can I click on it? Yeah, there we go. It's just going to take a couple seconds to load for you. And then you could take notes. We're going to do an activity afterwards, Desiree, for you to so we can discuss it. Since it's just you and I don't have anybody else here, you and I will do like a little session on it ourselves. Thank you for your patience, by the way. You're getting everything out of it so far, what it means for motivational interviewing. Mm-hmm. So if you have any questions after the video, please let me know. It's just taking a minute to upload.
Guidelines Collaborative. Changing behavior is one of the most difficult things to do, whether it's for ourselves or our patients. In this brief video, we will demonstrate a few motivational interviewing techniques to make your job a little easier by helping find a focus to engage patients in becoming healthier. The goal is not only to activate patients to make a needed change, but to help them sustain that change through learned self-motivational techniques.
Hi, John. Nice to see you again. So, tell me, how are things going?
Well, Doc, I know you told me that I need to lose weight. And even though the scale didn't show it today, I was able to lose about 5 pounds. But then I gained it right back.
Well, I appreciate you bringing your weight to the forefront. Do you mind if we explore this issue further?
No, by all means. I know we have to discuss it.
All right. Well, it sounds like you've been struggling with your weight recently, and I understand how difficult it is to lose the weight and then have it come back again. So tell me what you did to lose that initial 5 pounds.
I started watching what I ate, and I ate less. I've been eating more fruits and vegetables. I've also been walking more. I'm walking 20 minutes a day now. I saw the weight come slowly off. I felt better. But then when I watched it come back on again, I gave up.
But you did have some success. Tell me how you felt when you lost the weight.
I felt great. I felt really proud of myself. I thought that this was something that I could do.
Okay, well, it sounds like you realized that when you lost the weight, you felt better, and that it's going to affect your overall health. So tell me what you think changed that caused you to gain the weight back.
Well, I think it's because I've been eating more fruits and vegetables. That's it.
And how many servings of fruits and vegetables on average per day would you have?
To be honest, I have 4 to 6 glasses of orange juice a day. I have fruit for lunch and breakfast. I have usually 1 to 2 servings of a vegetable, like lettuce or broccoli, with dinner.
John, it's very important that you recognize that some fruits, but especially fruit juice, can contain a huge amount of calories. Did you know that a glass of orange juice has almost as many calories as a can of cola?
No, I didn't know. But doesn't the food pyramid classify fruit juice as a serving?
You're absolutely right. But keep in mind that the food pyramid is to be used as a guideline only. When it comes to nutrition, we have to have a more personalized approach. So I have a hunch, and that is the excess fruit that you are consuming probably caused your weight rebound. What's your impression?
Well, this changes quite a bit. I mean, here I'm thinking that my food intake is making me healthier and actually it's making me fatter.
Indeed. Let me ask you something. Knowing what you know now, how important is it to lose the weight by decreasing the amount of juice that you're currently taking in?
Obviously, I need to cut back on fruit juice. Boy, do I love that, OJ.
Oh, I understand. Let me ask you this. On a scale from 0 to 10, 0 meaning that there's no way you can do it, and 10 meaning that you're 100% confident that you can do it, how confident are you that you'll be able to reduce the amount of juice you're currently taking in?
6 or 7.
All right, so you're not a 0. So that tells me that you've got some confidence that this is doable. This is something you certainly can do. Why are you not a 0?
I guess it's because I know that I need to do it to lose the weight.
So you realize, again, that if you decrease the amount of juice you're taking in, you're going to decrease your weight, you're going to feel better, and you're going to impact your health positively.
Yes.
But you're also not a 10. And that tells me that there may be some obstacles to your success. What would it take for you to be a 10 or even an 8 or 9?
Getting the fruit juice out of the house. Because I know if it's there, I'll drink it. My wife does the shopping for us, so maybe if I ask her not to get the juice, that would solve it.
Okay. Now, if the juice was still there, can you think of anything else you could do?
I suppose I could replace it with a low-calorie drink or drink more water.
Excellent. John, I get the impression that you want to stay in course with weight reduction. And the best way to do this will be to decrease the amount of juice that you're currently taking in. So if I saw you in 2 weeks and I asked you how much juice you're drinking and how you did it, what would you tell me?
I'd say I didn't have any and I substituted it with sugar-free drinks.
Excellent. Well, it sounds like you have a plan. Same scale, 0 to 10. How confident are you that you can make this happen?
10.
I agree. All right. Well, you know what? I'm not going to start any medications today. Your labs were a little bit off, but I think we can handle this from a purely lifestyle standpoint. What do you think?
Great, sounds good to me.
Excellent. I'll see you in 2 weeks.
Okay. You can just exit out of that for me, Desiree, please. And you can just go back to the video slide. So, since there's nobody here, I just want to take a few minutes to reflect on what the video presented about motivational interviewing. I know it wasn't a counseling session, but it was a good video just to show the dialogue between client and counselor or patient to doctor equivalency. So if you wouldn't mind taking a few minutes just to reflect on that, and then you'll now discuss what you have. Is that okay? Thank you. Just a few minutes. And we'll go over the OARs further, so you don't have to concern yourself at this moment with that. And if you have any questions, you can just let me know. Another minute or so, Desi. That's right. some more time, Desiree? One more minute? Okay. Thank you. You got everything? You good? Okay, so after watching the interview, what did you glean from it? Like, what was your perspective of the video and in regards to motivational interviewing?
The guy, the patient, I should say, didn't feel like he was being bashed or anything like that.
You didn't think he was being bashed?
Like he was part of the conversation.
That's good. That's excellent. Yeah, he was part of the conversation. And why do you say that?
Because like, you know, with the questions and stuff, he had, like, you know, he just reflected back on what was going on with losing pounds and then gaining them back, so he, you know, could understand what was going on with him, and he just
So the counselor didn't make him feel less than because he didn't lose the weight or he didn't attain his goal of
he didn't laugh
losing
at
the
him or joke or anything
right.
like that.
But he gave him options
Exactly.
of
What was
things
going on.
like with his juice. The juice intake, we all know it has a lot of sugar in it.
Right.
So he said, okay, what could be some alternate plans for you to change? Maybe your juices with something a little bit more natural that's all 100% sugar-free. So what else did you, get out of it?
The doctor also helped him attain a few goals, you know, like, you know, what to do if you do have juices within the house, and what you do, tell your wife to get more, get water, you know, is it tempting, what do you do?
So he gave him he affirmed him, but he also reflected on some of his struggles and how he can incorporate his family into helping him lose the weight by not shopping for the sugar type of juices and maybe something, an alternative to the juices that he's drinking.
Right, just in case he has kids, you know.
Mm-hmm. I remember in the video he was talking about the reflective listening. What do you think about reflective listening?
It's good, you know, to like you're actually listening to what they're saying, so then you understand what they're saying, so when you ask them more questions, you don't ask them the same exact questions you've asked them like 5 times.
That's a good point. Reflective listening also is you're hearing the client, but you're also using verbal and nonverbal communication, like body language, to let the patient know that you're reflecting on what they're saying to you. Like a head nod, not all the time, but a head nod, looking them, eye contact, things of that nature. And then the reflective listening is the counselor, or in this case, the doctor, actually summarizing what he was saying back to the client in the client's own words. So that's excellent. And then eliciting a response from the actual client. Like when he reflects back on what he was hearing, he also elicited a response back from the client to have a dialogue, a communication for the client to change his eating habits or his drinking habits for him to try to lose the weight. So thank you, that was a really great exercise. So I want to move into the interaction style that we saw in the video, which you have up on the slide for you to review. It's the OARs of motivational interview. The first one is open-ended questions. This is where you elicit exploration of the topics. For instance, you don't want the client to give you yes or no questions, because especially if they're involuntary and they're there forcefully because the court or something made them go to counseling, you want to be able to strategize your questions where the client has to give you a response back. For example, what brings you here today, like when you open up the session? Or how has this problem affected